Hi everyone, welcome to Mind Body Magic with Dr. B. I'm Tiffany Ballard, and I'm thrilled to have you here today as we kick off a brand new series that's very close to my heart, functional medicine. Whether you're new to this concept or you've heard the buzz or are just curious to learn more, you're in the right place. In addition to covering an introduction to a series on functional medicine, I'll include a quick mind, body, spirit hack to help you, as well as a case example to keep it interesting. Before we dive in, I want to share a bit about my journey with functional medicine. As someone with ADHD, I've always been drawn to creative approaches. My learning journey into functional medicine is ongoing, and I'm here to share what I've learned with you, not as a guru, but as a fellow learner, a guide. I owe much of my knowledge to amazing mentors like Dr. James Greenblatt and his Psychiatry Redefined Fellowship in Integrative and Functional Medicine for mental health. It's exciting to integrate this into my practice and even more thrilling to share it with you, to add the knowledge to your toolkit so that you can take back your health. So what exactly is functional medicine? Simply put, functional medicine is a personalized, systems-based approach to healthcare. Instead of just treating symptoms, we focus on identifying and addressing root cause or causes of disease. Imagine your body as an intricate web where everything is connected. Your organs, your mind, your emotions, and even your environment. Functional medicine looks at that whole picture. Now, you might be wondering how this differs from conventional or traditional medicine. Well, conventional medicine often focuses on treating specific symptoms or diseases, and functional medicine dives deeper. We ask the important questions. Why is this happening? And how can we address the root cause? And it's about moving from a reactive to a proactive approach to healthcare. If you're a doctor or someone working in healthcare and you found it frustrating to hear about the comparison of functional medicine to conventional medicine, you are not alone. I've been there. And as an osteopathic physician trained in an allopathic residency, I've seen both sides. Working together, we can create a more holistic, integrative approach to health. Let me share an example of how integrative and functional medicine can shift the way we approach our health and healthcare. Take Sarah, for example. She's a 38-year-old woman who's been diagnosed with mild depression. She's been managing it with a low dose of antidepressants, and generally, she felt okay. But lately, things have changed. She noticed her energy levels have tanked. She's feeling more meh than ever before, and it's like she's just going through the motions of life. She's not feeling the same motivation or joy or engagement as she was before, like spending time with friends, hobbies. Her depressive symptoms seem to have crept back in stronger, and she's more tired than ever. And naturally, she's worried. If Sarah were to go to a conventional primary care doctor or psychiatrist, they might see this as a sign that her depression is worsening or that her current antidepressant is no longer effective. And the typical response might be to either increase her dosage or switch to try a different prescription medication. And for some people, that might be necessary. But when Sarah sees a functional medicine and integrative trained practitioner, they dig a little deeper. Instead of jumping straight to altering her medication, they run a comprehensive panel of blood work if one hasn't recently been done, and this includes checking her vitamin D3 levels. This tests tend to still get overlooked. In functional medicine, they recommend checking it more than annually, but insurance still doesn't completely cover vitamin D for all policies, which is a statement about the systems we need to change. Sure enough, when the labs come back, Sarah's vitamin D3 level comes back significantly low. And vitamin D is critical for energy, mood regulation, overall well-being, as well as your immune system. And being deficient in it can mimic and can even exacerbate existing depressive symptoms. So instead of adjusting her antidepressant, Sarah's functional medicine doctor recommends she start supplementing with vitamin D3 and a therapeutic dose to correct it. Fast forward a few weeks, Sarah feels like herself again. Her energy's back, her mood is improved, her mojo is back, she's re-engaged with life. This isn't to say that antidepressants aren't useful. They certainly can be useful. But in Sarah's case, addressing her underlying deficiency made a huge difference. And this is the kind of nuanced care that integrative and functional medicine provides, looking at the full picture of what might be going on in the body and not just assuming it's all about brain chemistry. What makes functional medicine truly unique is the individualized care it offers. We recognize that each person is different, so is the path to wellness. This approach integrates genetics, lifestyle, and environment to create a personalized plan that addresses your unique needs. It's about empowering you with the knowledge and tools to take back your health. Now I want to take a moment to honor the incredible work of conventional medicine, traditional medicine. Our doctors, nurses, and healthcare professionals are doing amazing work, especially in acute care settings. And functional medicine isn't here to replace conventional medicine, but to complement it. And by working together, we can create a more holistic and integrative approach to health. And maybe in the future, we can add functional medicine lab testing so that more of these are covered and they get put into the training programs and systems. All right, as promised, here's one experiential 1-minute hack that you can add to your toolkit to help your mind and health. You know those moments when you're sitting in front of the computer and you're reading emails, or you're just stuck in a loop, or suddenly realize you're really frustrated or just off? Well, first of all, give yourself some serious credit. Just noticing that emotion and that you're feeling that way is actually being mindful and present, and that's a big deal. When that happens, take just 1 minute to step away from the screen. If you can, go outside for a quick breath of fresh air. Bonus points if you can get barefoot in the grass or on the dirt or cement. Grounding yourself really helps reset your energy, and there's science to back that. Or if you're indoors and can't get outside in a minute, go up and down a flight of stairs just to get your body moving. Even going and brewing a cup of tea can work. It might take a little longer than a minute, but the act of stepping away and shifting your focus is what counts. There's a reset going on where you could feel in a very different emotional state and ready to step back in front of that screen again. Your goal here is simple. Break the emotional cycle with just a minute of movement or nature, and when you come back, you'll feel a little more centered and ready to take on whatever's in front of you, and it will feel different. Congrats on your mind-body win and for adding a new tool to your toolkit. If you like these, please consider subscribing for more meditation, creative ways to learn about functional medicine in ways that you can feel empowered by to take action and changes in your life. Thank you. I'm so glad you were here. Take care of your heart and mind.